Hi friends, welcome back. In today's video, in this tutorial, I am gonna show you how you can pinpoint any pain in the abdominal region. So in today's video, I just wanna show you how you can simply diagnose any type of pain or identify any type of pain in the abdominal regions. So for you to identify or pinpoint the type of pain in the abdominal region, you must have basic knowledge about the anatomy or the organs that are involved in the abdominal region. So basically, the abdomen is divided into 4 quadrants and 9 regions. So let us have a look at it. So as you can see, we have divided the abdomen into 4 quadrants and 9 regions. Let us see them now. The first part is the right upper quadrant and the left upper quadrant. We also have the right lower quadrant, and that is left lower quadrants. So these are the 4 quadrants of the abdomen. We have also divided the abdomen into 9 regions. The first one is right upper quadrant. The second is the epigastric, that is in the midline of the body. We also have the left upper quadrant. So the fourth area is the right lumbar quadrant. We also have the umbilical region, which is also known as the hypogastric. So we also have the left lumbar region. We have the right lower quadrant. We also have the suprapubic region. The last we have left lower quadrants. So these are the quadrants and the regions of the abdomen. So let us see now the organs that are involved in the abdominal regions, because for you to trace or simply identify and simplify a possible diagnose any type of pain in the abdomen, you must be well conversed or familiar with the organs that are involved in the abdominal region. The first is the right upper quadrant. So in the right upper quadrants, we have the liver, we also have the gallbladder, we also have the bile duct. Okay, in the epigastric region, we have the liver, the stomach, and the pancreas. Okay, in the left upper quadrants, we have the stomach, the pancreas, and the spleen. Okay, in the right lumbar region, we have the right kidney, the small intestine, and the colon. In the umbilical region, that is the hypogastric, we also have the small intestine, the colon, and the aortic. So in the left lumbar region, we have the left kidney, the small intestine, and the colon. Okay, what about the organs in the right lower quadrant? We have the appendix, we also have the colon and the ovary. What about in the suprapubic region? We have the urinary bladder, the ovary, the uterus or fallopian tube. What about in the lower left quadrant? We have the descending colon, the ovary, or the uterus in women. So these are the organs that are involved in the abdominal regions. So let us now identify any type of pain. What are the pain that are specifically in your abdominal regions? So in the first part, that is the right upper quadrant, you may have a disease that is involved in the liver, the gallbladder, that is the bile duct, which includes the hepatitis or hepatic abscess, gallstones, cholecystitis. So these are the diseases that are involved in the right upper quadrants. We also have in the epigastric. So in the epigastric, organs involved include the liver, the stomach, the pancreas. So in the epigastric, any type of pain is specifically in your upper part. This is the upper part of the stomach. You may have conditions like maybe liver problems, gastritis, gastroesophageal reflux disease, peptic ulcer disease, or maybe the pancreatitis. Okay, we also have the left upper quadrant. In the left upper quadrant, organs involved include the stomach, the spleen, and the pancreas. So you may have conditions like gastritis or splenomegaly, that is enlarged spleen, or maybe pancreatitis, that is inflammation of the pancreas, or maybe pancreatic cancer. Okay, let us also see the right lumbar. So in the right lumbar, organs involved include the kidney, the small intestine, and the colon. So you may have conditions, if you have any pain specifically in your right lumbar region, you may have conditions like kidney stones, or maybe pyelonephritis, that is kidney infection, or you may have colitis, that is inflammation of the colon. Okay, we also have in the umbilical region, we have organs include small intestine, the colon, and the aortic artery. So in this, any vein typically in the umbilical region, you may have conditions like colitis, that is inflammation of the colon, or maybe you have a gastroenteritis, that is infection of the intestine. You may also have maybe a ruptured aortic or maybe mesenteric ischemia. So these are the conditions you may have. What about in the left lumbar region? So in the organs involved in this region include the kidney, the small intestine, and the colon. So you may have condition like maybe kidney stones, pyelonephritis, that is infection of the kidney, or maybe colitis, inflammation of the colon. Okay, we also have the right lower quadrant. In the right lower quadrant, and you may have organs involved include the appendix, the colon, and the ovary, or maybe the fallopian tube or uterus in women. So you may have conditions like appendicitis, that is inflammation of the appendix, colitis, that is inflammation of the colon, or maybe endometriosis, BID, that is pelvic inflammatory disease, or maybe STI, that is sexual transmitted infections. Okay, we also have the suprapubic. So in this region, we have the urinary bladder, the ovary, the uterus, or the fallopian tube in women. So you may have conditions like maybe an endometriosis, and BID, that is pelvic inflammatory disease, STI, that is sexual transmitted disease, or maybe ectopic pregnancies. So these are the conditions that are involved in the suprapubic region. We also have the left lower quadrants. So in the left lower quadrant, we have organs that are involved include the descending colon, the ovaries, the uterus, or maybe in the fallopian tube in women. So you may have conditions like colitis, that is inflammation of the colon, or maybe ovarian cyst, ovarian torsion, endometriosis, BID, or maybe STI. So these are the conditions that are involved in the abdominal region. So never consider any pain that you feel in the abdomen. Maybe it's just like, or thinking like is a stomach ache or stomach pain. So besides this, pain can be involved. So other conditions. So whenever you are diagnosing any pain in the abdominal region, you must consider the following: the type of pain, maybe if it is sharp, dull, cramping, or maybe burning or stabbing, and the severity of the pain, that is if it is mild, moderate, or severe, and duration, how long has the patient been present. You must also consider frequency of the pain. Does the pain come or go, maybe radiate or fluctuate? You must also consider associated symptoms. If there are any other symptoms like nausea, vomiting, fever, or changes in the bowel habits. So this is how you are going to identify, simplify a possible diagnosis any pain in the abdominal region. I hope you find the video very helpful. So please don't forget to subscribe, like, and share, and give your comment to this video. Thanks for your watching. See you in the next video.